People are drinking more and drugging more simply because partly because they've got more time, but they're feeling unsettled. And anybody who has a drug or alcohol problem, as soon as their stress level feels like it's going up, they're going to start to do that more. And that really starts to exacerbate or make mental health problems that are concurrent much worse. Both cannabis and alcohol are huge factors in increasing depression. Both cannabis and alcohol are huge factors in increasing anxiety. But our thinking around those things is that somehow or another they help us. And so even though your alcohol use is making your depression worse, there's a thought stuck in your head that it's helping me. So you start to do it more. And realistically, if you get a little bit hammered, you stop caring about the stuff that was bothering you. But underneath that, it's really disrupting your dopamine and serotonin supply, which is going to make your depression worse. And you mentioned suicide. The other thing that chronic drug use does is it reduces our capacity to think properly. Like anybody that's drinking regularly or using drugs regularly, their brain isn't operating at the same level as it could. So it's harder for them to make decisions. It's harder for them to see their way through a situation. They'll give up easier. And so suicide tends to become a bigger risk. And one of the things about suicide is it's tied to depression, but it's also tied to anxiety. And when we look at depression, it isn't just I can't get out of bed kinds of things that people look for while he's depressed or she's depressed because she's lying around all the time and can't get out of bed. There's a whole bunch of other symptoms. Change in sleep patterns, change in eating patterns, increase in irritability. Those things are also signs of increasing depression. And so people, if they've got somebody in their family that has a pre-existing mental health issue, they need to make sure that they're up to speed on what really are the symptoms of that. And it isn't necessarily just one thing. And I guess the biggest problem with all of this stuff is people don't want to talk about it, which is why we're doing this show, is to open up the conversation about substance use and about mental health issues, because when you hide something, it gets bigger and bigger inside you, and at some point it gets too big, and then people start checking out.